iTrax is a new smart endotracheal tube that aims to reduce tracheal injury and ventilator-associated pneumonia for patients in critical care and surgery. iTrax comprises an endotracheal tube with sensors integrated into the inflatable cuff and a measurement unit. To assist breathing during surgery and critical care, an endotracheal tube is inserted to maintain the airway. A cuff is inflated to form a seal to prevent gas leaks, enabling an air and oxygen mixture to be effectively delivered to the lungs. If the cuff is underinflated, then gas is not effectively delivered to the lungs and secretions leak into the lungs. This can cause ventilator-associated pneumonia, or VAP, which affects 10 to 20% of ventilated intensive care patients. On average, it increases length of hospital stay by 6 days and mortality by 10 to 20%. Each episode costs around £12,000 in the UK and $25,000 to $40,000 in the US. If the cuff is overinflated, this causes injuries to the trachea as oxygen-carrying blood is squeezed out of the tissues. In the UK, this ranges from 500,000 cases per year of severe sore throat to 2,000 cases of a potentially life-changing condition called post-intubation tracheal stenosis, or PITS. There is therefore a narrow window of cuff-trachea interface pressures to maintain a gas seal but avoid injury. iTrax addresses this challenge. Correct cuff interface pressure maintains the gas seal without pressing too hard on the lining of the trachea. Thin and flexible optical fibers integrated in the tube deliver light to and from the contact pressure sensor at the cuff. A highly sensitive optical strain gauge called a fiber Bragg grating is embedded in a custom-made capsule that converts the pressure applied into a measurable strain. The optical strain gauge reflects a specific light color back to the detector, and this color depends on the strain, so we can relate interface pressure to optical signal. Photoplethysmography is used to measure the blood in the lining of the trachea. This can be used to ensure whether sufficient oxygen-carrying blood is delivered to maintain a healthy trachea. Using optical fibers, light is delivered into the tissue, and this is absorbed by the blood. The reflected signal is collected by an optical fiber, and this is used to obtain the amount of blood in the tissue. The reflected signal is also used to measure heart rate and oxygen saturation, which are important physiological parameters. Measuring these in the core in critical care is potentially more reliable than measuring on the finger. We believe that iTrax is capable of improving the experience of surgery and critical care for patients worldwide. It will significantly reduce the suffering and costs associated with tracheal injury and ventilator-associated pneumonia at a cost that is acceptable to healthcare providers. In addition, iTrax will demonstrate the potential of emerging optical sensor technology to enable sensing of the internal environment of patients in real time, providing previously unavailable data to aid clinical decision-making.